There's like 3 or 4 new Victor Wembys now.
I know.
There's a kid that's 14 that's 7'2", and he can dribble. I'm like, God damn, man.
That's one guy that I think if he can stay healthy, he's going to be the guy.
He's going to be like, he already is.
All right, we're live right now. We are live on
What's up, guys? We are live, getting everything set up. Titan Lifestyle. We do this every week. Get your questions ready.
Jason NYC, what's going on? We're waiting on TikTok to get online. We got a great show for you guys. Land 1018, El Centro, O'Keen Fitball, Sophia Morgan, Last of Your Kind, Doris Vell, Joe Rift, Magana. Good morning from California. A little fied. Yeah, it's a little earlier in California. What, 1:12? It's about 11 a.m. right there. Good morning to you. Hey, Pike, how you doing? Tyson, what's going on? Are we on TikTok here? Yeah. I'm not seeing it pop up on my side. I'm sorry.
Also, guys, girls, get your questions ready. We'll be taking Q&A throughout the show. So if you got a question, type it in. We'll get to it as soon as we can.
I cannot see TikTok for some reason. There it is. Got it. Thank you. All right. Lamida, Carlos, what's going on? Okay. All right. So, welcome, guys. Happy Friday. Titan Lifestyle with Big Drew and me.
That's right. Titan Lifestyle. Every week, 2 p.m. we do this. Good to have John back.
Yes, sir.
Got a packed week. Got a packed show. Therapy of the week. Absolutely. Crazy topics, as always.
Yeah, we got some good ones for you guys today, for sure. We always do, right?
Yeah.
Always setting you guys up with some great weekend entertainment. Yeah. So, let's get into it. Listen, if you guys have any questions about what we do or how we can help you guys out, nationwide service here at Titan Medical Center. So wherever you guys are at, we can service you guys. Hormone replacement therapy, males and females, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, both males and females, peptide therapies, and all kinds for you guys. Blood work nationwide and much, much more. So at that point, you guys can ask us anything. We'll hit the questions for you guys, give you the most honest answers we have, and try to share some education, share some knowledge, and maybe we'll learn something too from you guys.
Yeah.
So join along with us and let us know what you guys think. Also, if you guys think of anything that you might want to see in the future episodes, please drop us a comment down here, and we'll try to incorporate that.
Yeah, definitely. Any questions that we don't answer or any crazy topics, doesn't have to be about weight loss and gaining muscle. Could be pretty much anything health related. Could be other stuff too, but health related is what we like to focus on here at Titan Medical. Yep. So any of the questions that we have, if we don't get the full answer to, guys, let us know. We'll come back. And again, like John said, anytime you guys give us a topic, it's better. Yeah. We try to pick out topics that you guys and girls will find interesting. Yeah. But the best way to know that is for you guys to just tell us what you want us to talk about.
For sure.
So, anything you guys want to talk about within reason, this is a PG show.
Yes.
We'll get to it. And we'll get to it.
All right. Awesome. So we got our first question on TikTok. Will I see progress on 200 milligrams of test every 2 weeks?
Definitely.
You will see progress. But every 2 weeks, it's kind of, and depending on how you're injecting this testosterone too as well, it's going to determine how you're going to be feeling. So if you inject on a Monday, right, and then you go to the second week, you might be feeling a little bit down, right? Yeah. And that's because your levels are probably dropping. So splitting the dose might help if you do that per week. 100 milligrams per week is really not that much, but you should see some progress. But patients usually take 200 milligrams per week. Yeah. And that's, what the normal dosage is. And they're splitting that dose in the week, like every 3 days. So Monday, Thursday, Tuesday, Friday, Wednesday, Saturday, whatever it is. Yeah. And that would probably give you the best feeling and better result, too, as well.
Right. And again, too, if you're doing 200 milligrams every 2 weeks, I'm assuming that's your injection frequency where it's every 2 weeks. Like John said, you're gonna feel a lot better if your blood levels are stable. Yeah. If you're going through a medical provider, just ask them, say, can I do, if 1 ml is 200 milligrams or 1 cc is 200 milligrams, ask your medical provider, say, hey, can I do a quarter twice a week? So then you'd be at 0.25. So you're still getting the same 200 milligrams for the course of 2 weeks.
Right.
But you're getting 100 milligrams a week. So it's going to keep your blood levels a lot stable.
Yep.
I know over here at Titan Medical, usually our medical providers will prescribe, testosterone, cypionate, and usually the injection frequency is like a Monday, Thursday, like John said, twice a week. So in terms of results in the gym, results in the mirror, that may be the same, but your blood levels are going to go up and down. You may get a little bit of side effects, a little bit of mood swings because you're all over the place. Better to just keep it consistent. And plus, with that way, too, you're not injecting so much at one time. So, the less amount you have to inject each time, the simpler it is.
Absolutely. Next question from him, and then we'll follow up. We got some other questions from YG Lee and such on TikTok, and we'll get right there. So the next question from him was, how high can my test levels get off that protocol? Before starting TRT, my blood was at 250. So if you're talking about the 200 milligrams every 2 weeks, you should really test and see exactly where it's going to be at. But, I mean, I don't know, maybe 500-600 maybe? I mean, you want to be more optimal than that. If you're going to inject testosterone, you want to at least get up to the higher end of normal range. And that's about 900 to 1,000. If it's a Quest reference range, it's up to 1,150. So anywhere with there, I mean, if you were to take 200 milligrams a week and it spiked on that day, it could be at 1,500. But usually you're going to stay around that higher range of 900 to 1,000, maybe 1,200 tops. And that should make you feel optimal. That's not a crazy super physiological dose. So it's not like you're doing bodybuilding doses or anything like that. But it will get you feeling good. You'll get better results, recovery, more lean muscle, better clarity because it's testosterone receptors in the brain, and everything that comes along with it.
Yeah, another thing is, too, is you said if you're doing your injections every 2 weeks, if you do your injection and wait 2 weeks and then get your blood work done, you're not really going to have an accurate reading because of that up and down spike. So in other words, if you take a shot of testosterone on Monday, and then that same day you go to get your blood work done, it might be a little bit elevated. If you wait 2 weeks, say if you do an injection on, let's say, the 1st, and then you get your blood work done on the 14th, but your next injection is until the 15th, it might show an inaccurate reading because it's going so low because it's not stable. So another reason you want to keep your blood work stable is so you get an accurate reading on your testosterone. I've had guys have elevated testosterone if they do testosterone propionate, which is a fast actor. They'll inject it, then get their blood work the next day. It'll be way too elevated. Then if they would just wait another week and get it done again, it may come back down to normal. So that's another reason, too, is to make sure you have an accurate reading. And if you get your blood work done, you get testosterone, it goes up. Get it done again just to make sure it's doing what it's supposed to be doing. A lot of times people will just get it one time just to get their foot in the door, and then they just go off of it. So it's always good if you can to just keep retesting, make sure it's good, make sure it's not going too high, too low, so you can be optimal right in that middle range.
Absolutely. And we'll get right to Last LaSalle on TikTok in 1 second. I want to switch over because YG Lee and all these questions on Instagram, so we want to go back and forth.
YG Lee's talking about the beard.
Yes.
How do you get a fuller beard? Actually, we have stuff here that'll help your hair grow.
Absolutely.
We have stuff topical stuff you can put on your head. I'm assuming it's safe enough to put on your face. But again, that's a lot of genetics going with a full beard.
Of course.
If your dad or grandfather had a lot of facial hair, there's nothing you could really do to increase it, like to make it naturally full. But again, testosterone will literally increase your hair growth a little bit too. So if you're low T, if you've always had low T your whole life, you may be the guy that doesn't have hairy arms, doesn't have a hairy chest, can't connect the beard. A little bit of testosterone will actually help that. And that's actually a negative side effect of women taking too much, because all women have a little bit too much testosterone.
Right, and they start getting facial hair.
Yeah, you don't want to have facial hair.
You don't want the bearded lady running around your house.
Yeah, you don't want definitely don't want the beard. And you don't want the shadow too. A lot of women, they take too much testosterone, so then they have to cake on the makeup, and it has like the shadow. Even though it's smooth, it has a shadow. You don't want that. But yeah, we have stuff for your hair, skin, nails. Biotin will help a lot with that too.
Absolutely, injectable biotin for sure.
Yeah, injectable biotin will help with your hair, skin, nails. Testosterone will help. The topical cream that we sell here will help as well. And then a lot of stuff you could do that will take your hair away, which is not good. So in other words, too much testosterone could actually cause a decrease in male pattern baldness too. So yeah.
Yep. All right. So Brian, how you doing? Tom, what's up? We'll answer that question in 1 second about BBC. Danielle, how you doing? Little Fid 07 said, I developed a bad itch burning sensation when I get hot after about 8 months on TRT 200 milligrams a week. All right, so are you taking an anastrozole? Are you taking an aromatase inhibitor? That's one question. And usually when you're getting this burning sensation, where are you getting this burning sensation at? Because usually this is very kind of uncommon. And let me tell you why. Is because usually if you have a reaction from something, it happens off the first time. Right? So if like a patient called us and we're like, hey, I've been taking testosterone for 8 months, and now all of a sudden I'm getting this burning, itching feeling. I'd say, well, that's kind of weird because you've been taking it for 8 months, right? And if it hasn't happened the first couple of times, it's usually not going to happen. So it might be something else you might be incorporating in the regimen, diet, topically, or something got on you. I don't know. How many times has this happened where you've been on testosterone for about 8 months and you start getting a burning sensation? That's the next question.
Another thing, too, with the burning sensation is what else are you doing, like John said, before you get that? I know niacin, a lot of times people will take pre-workouts, which I'm not a fan of. ECA is a lot better option, but a lot of times people take pre-workouts that have niacin in it. And a lot of women, they don't like the itchy, tingly feeling. I kind of used to like it because I knew it was kicking in.
Right.
But that could be a thing too. So if you're only getting hot and itchy when you get hot as you're about to work out because you're taking that supplement, that could be it too. So always look at your niacin. Like if you mix up some garbage, if you mix up some garbage powder pre-workout that has a whole bunch of niacin, you take that, and then next thing you know, as soon as you get warm, then everything's kicking in. You have the itchy phase. That might be it too. So I check the labels and all the stuff you're taking. Make sure there's no niacin in it first. Because again, like John said, if it's been 8 months, I can't assume the TRT all of a sudden after 3/4 of a year decides to make you have a side effect.
All right, last us out. So we're back to TikTok, and we'll go right back to Instagram in 1 second. If we have anything else on YouTube or anything else, we'll get to that too as well. Last Cell said, I almost gave up my 3-month workout and took a week off, but I'm back in the gym now. And then how do you stay motivated? So that's awesome that you're back in the gym. Listen, taking the week, that's fine. Getting straight, your mental straight, and getting back motivated. Listen, at least you didn't stay out of the gym forever, right? How to stay motivated. So at that point, there's a lot of different things you could do to stay motivated. One, I mean, you should be looking at your results. And weekly, you should be doing, your check-in pictures and comparing them and seeing, hey, listen, where am I at? Where was I at before? Am I making progress? Progress should keep you motivated. Two, make sure your hormones are dialed in, because if your hormones aren't dialed in, like testosterone per se, you're going to be unmotivated. You're not going to want to do these things. But I think that's the biggest thing for me. I think the results, seeing the results, feeling better, I think, after the workouts and stuff like that, keep me motivated because I know I'm on the right path.
Another thing, too, if you took 3 months off, I'm assuming you're on HRT. If you're on HRT, some places they don't give enclomiphene. If you're taking a good amount of testosterone, injectable, which isn't natural testosterone, you can get, if your low T drops low, you can get real lethargic. So a lot of times guys will take HCG or enclomiphene to bring up their natural, to keep their testicular atrophy from happening. So I know with me, when I'm doing HRT, without the enclomiphene, I get a little worn down, not too much, but I definitely notice a difference. So a lot of times people say HRT, but all that means is they're doing an HRT doses. They're not doing the proper protocol along with it, like, anastrozole, tamoxifen, and clomiphene. That could help too. So.
Early Brewer, we'll get right back to on TikTok, Instagram. Tom, what's going on, Tom? How do I inject my BPC 157 in my rear delt when I can't pinch?
Oh, you mean pinch to get it in there?
Okay, all right. So if you can stick it straight in, you can do that. So if you were to go like this and go right into your lat, you can do that. You can go straight in. It doesn't have to be subcutaneous, but it's in that area, and we like to be subcutaneous. But if you can go straight in, that would be the way to do it. If you have somebody that can help you inject it there, that'd be another route you could possibly go. But the pinching. So if you do this pinching thing, and another patient gave me this tip, and I utilized it in seeing. It's actually one of my good friends, their brother that I grew up with. So he was doing his elbow. He's like, John, how do I pinch my elbow and do an injection at the same time? So I'm like, So he's like, listen, there's those little chip clips, and they're like this. So you could probably put that on there like that, and then you could probably go right into it like that.
Or even an old school clothespin or something that clips.
Yeah. Just make sure it's sterile, all right? Wipe it down with alcohol, the whole nine, so you're not going to get anything in there. But that would probably be the best bet to do, for sure, 100%, Tom.
And like John said, you could have someone else do it too. So a lot of times people that don't do injections, they're so afraid of it that, I can't do that. What do you mean? I'm going to hurt you.
Right.
The easiest way to show someone how to do an injection is do your own injection on yourself first. Something that you're prescribed, not just some random thing you found online.
Right.
But if you're prescribed any type of injectables where you're using an insulin needle, show them how easy it is, whether it's your bicep, elbow, just show them how smooth it is first. Oh, okay, I could do that. Then you can hand them so they can, do your rear delt. But like John said, you can go straight in on the rear delt. Make sure it's the middle, go straight in. You'll
be fine.
You're really not going to pinch too much back there. A lot of people don't have a lot of fat on their rear delts.
Yeah, that's true.
So it's even skin's hard. It's hard to get a hold of piece of. It's easy to get loose skin here because you bend it creases in.
Of course.
But when you have something that your rear delt never has that fold where the wrinkles come up, so just have someone just go straight in with it. Make sure it's sterile as well. New needles all the time too.
Yes.
We haven't talked about that enough here. We always talk about cleaning the injection site, but I heard a guy was talking to a guy on social media in my inbox the other day. He was like, yeah, I just dunked the needle in alcohol. That way it kills everything.
Oh, my God.
And I've heard of people doing that plenty of times. I've heard of people taking a needle, they take an insulin needle, they put it into the bottle of rubbing alcohol, suck the suck the alcohol into it and then squirt everything back out.
Oh, no.
But if you do that, if there's any alcohol in there, it's going to burn like crazy.
Oh, for sure.
And not only that, the tip it may be sterile, but it's dull.
Oh, yeah.
It's not made to go in and out of a stopper, in and out of your skin.
Definitely
so then you have scar
not.
tissue, so then you have a whole bunch of little freckles. So
Yeah.
always use a new needle every single time. Needles are cheap, real cheap. And we usually send at least like...
Needles and syringes are one-time use.
Yeah, when we send a ton of them to people too. So when we send you guys your little orange insulin needles, use a new one every time.
Yes.
If you don't know if it's new, toss it just to make sure and get a new one.
Trust me, it's worth it, guys. One infection, dude, is you're gonna have to cut out some meat, or you're gonna have to take antibiotics. I mean, it's just it's gonna be a little time consuming and taking time away from where you should.
Defeats the purpose of having the physique you
For
want.
real.
Yeah. Especially if you're doing it into that localized muscle, because you want that muscle to have a pump, whether it's Hercules potion.
Yeah.
Just think about doing a bad injection, and then now you have scar tissue that you can't. Now you permanently can't do it. So
It sucks.
be safe. New needles every time.
Early bird starting to hold water weight on TRT. Should I take 1 milligram of anastrozole a week? Estrogen was at 90. So listen. You need to have a provider or somebody to look at your blood. It was at 90. That's too high, and that's why you're holding water. I tell this to people all the time. You know, I get a lot of people online that say, listen, or people that are going to general practitioners and just getting testosterone, maybe to a company that's just selling them testosterone. And some of the answers they tell me is like, well, they told me not to start this or not to even think about it when I started having symptoms. So it's not, you know, if you're going to have symptoms, 98% of the time, you are going to get symptoms if you do not have a blocker. There are a small percentage of people that might not need one, but I'm telling you, 9 out of 10 people that we see on blood tests, and I would say 9.5 out of 10, are going to need an aromatase inhibitor. How much that is, that's a different story. But at that point, like water weight, that's an instant. Like, all right, and then 90, you did a blood test and you verify the number. Yeah, you want to get that down to 20, 30 at the highest. When you start getting to 40s, 50s, 60s, 70s, 80s, 90s, then we're starting to get a little higher, and you're going to start getting those negative symptoms.
Yeah, another thing, too, with estrogen, a lot of guys, a lot of bodybuilders, they attribute estrogen to sore nipples because of gynecomastia, where you can actually develop breast tissue from high estrogen over long periods of time. So a lot of guys say, oh, no, my nipples aren't sore, I'm fine. Right. That's not the only side effect. I know guys that have been taking testosterone for years that didn't have any type of puffy nipples or anything, but their estrogen's through the roof, and they have all these other stuff going on. So don't just say, "Oh, I'm fine. I don't have acne. I don't have puffy nipples. I should be good." That's just a side effect. The side effect doesn't necessarily mean you're gonna get it, but you may have high estrogens. My estrogen tends to go high. So when I came to Titan, they put me on the anastrozole. My estrogen was still high. So then, work with the medical provider. Now they have me on tamoxifen and anastrozole, a back and forth type thing. You may actually need that. So if you're taking anastrozole and you feel like it's not doing its job, there's always different recommendations you could tell us. There's a couple other ones as well. Anastrozole is like the main, strongest one or whatever.
Yep.
But
it's the most widely used one. It's easiest on that as far as that goes.
And if you hear me say anastrozole or John say anastrozole, it's also known as Arimidex. Yeah. So a lot of times in the bodybook, they'll say Arimidex. That was just a company that made anastrozole.
Yeah, commercial brand.
Yeah, so it's kind of like Advil is ibuprofen, Arimidex is anastrozole. So anytime you hear of us say anastrozole, if you're looking it up, you can look up anastrozole or you can look up Arimidex. You're going to get the same info.
All right. We'll go back to Instagram, then back to you guys on TikTok. You guys got some great questions. Keep them coming. All right,
Sophia.
Jay Martin said, how much to get started, TRT? All right, so TRT to me is just testosterone replacement, so you're just asking for testosterone. What we do is hormone replacement therapy, which involves testosterone, but it would involve 2 other components. One, like we talked about, an aromatase inhibitor, probably an anastrozole. After that, we're going to do a gonadal support and add-back therapy to make sure your natural production doesn't get cut off, and your semen production doesn't get cut off, and you're aesthetically pleasing on the bottom end and not having shrunk raisins there. That's going to go anywhere between $225 and $375 monthly. That includes all 3 medications, your syringes, shipping, medical review, everything out the door. It's one transparent package for you guys. So that's what it would be. Next question is how would you recommend to use MK without Slim, which is
Humalog, which is insulin,
which
not good.
We probably wouldn't recommend that
ever.
Anyway. Yeah, you wouldn't need that. And what we'd recommend for MK is there's 2 different ways you can take it. One, if you're trying to stimulate the hunger hormone ghrelin and you want to get the more calories in, you could take it during the day. In the morning would probably be most beneficial on an empty stomach. That way it hits you and it's the most potent. If you have an empty stomach, that's always the best way to hit.
Another thing, too, is if you're using insulin, which isn't good because, if you take it wrong, you could literally die. You could black out. I've known someone that took it in the break room and they woke up in the hospital with their girlfriend holding their hand because they didn't have their carbs and all this stuff.
Yeah.
A lot safer way if you want to get the same effect as the insulin is to do MK-677 with Hercules Potion or IGF or both.
Yeah.
So if you do an IGF Hercules blend and you spot inject that before you train, the swelling, the good swelling, the pump, your muscle's going to feel like it's going to explode. A lot of guys, the only reason they use insulin is because they get such a pump, but then you have all these other problems too.
Right.
So if you really want to, the closest thing to have that feeling where localized growth pump in specific areas, I would say Hercules Potion first, IGF first, Hercules Potion second. If you can, you could run those together. Right. Those are completely safe to run together.
Absolutely.
You can put them in the same syringe. So say if you're doing 0.2, whatever your dosing is on your IGF, you could put 0.2 IGF and the rest Hercules. Boom. You're gonna have a crazy workout, just like you would with the Humalog. Humalog's not good. If you guys hear Humalog or any of the logs type stuff you hear, or you see Slin, that's insulin. Take that the wrong way, you literally die.
Yeah.
Is it really worth it? I don't know. And a lot of times, too, I had a conversation 2 days ago with someone. I've never seen someone take insulin and look better. It's almost like a mental thing. I've never said, he looked this way, and all of a sudden you take insulin and now he look. I've never seen it. Ever. Usually guys look worse because it smooths them out and the scale goes up, but they look almost worse.
Yeah.
So I've yet to see someone look better before and after picks off insulin. Now, IGF, I've definitely seen a difference.
For
HRT,
sure.
I've definitely, even Hercules Potion, if you look at my videos before I work out and afterwards, it's like night and day.
It's ridiculous.
So I don't just go off of people saying what to do. I do it myself. So instant results, instant pump, IGF, Hercules.
Yeah. Eric No Limit, Mullet Marshall, Pushing Pesto, Jay Pano, KR Raleigh, Chico, Chris, how you doing here? J Martin 847, we'll answer this one and then we'll go back to TikTok. He said, Florida Alternative bailed on me in the middle of getting meds. Now I'm left with nothing.
Come on over.
Real sorry about that. Places like that give us a black eye in our industry. But if you did come to Titan Medical Center, listen, we've been doing this for over 11 and a half years. We've been around for a long time. We've got great reviews. You can check them out anywhere. And we're going to be able to take care of you. And we're going to make sure you get your meds and we're not going to leave you behind. Even if we were to say, hey, we're done, we'd be at least getting a hold of you, making sure you were set up somewhere else, and at that point be able to give your money back.
Yeah, one thing with Titan is, I'm not going to say they're annoying, but they will definitely keep in contact with you.
It's
It's not like another place where it's like, oh, I have to hear from them. People are like, I'm getting emails, I'm getting newsletter, I got the lady texting me.
Yeah.
So we're always on point, make sure you're real good.
It's your health, so we want to make sure we keep you on track. The whole point is a lot of people can't keep on track. So we're there to help you stay on track. And I know there's some other alternative places out there. There is no alternative to Titan Medical Center. Yeah. There's no premier alternative. There's no Florida. All these places, they're just that. They're weak alternatives to what you can really get from Titan. So,
alternative basically just means it's not the real thing. Even if you look it up, if you look at what alternative means, it's almost like bootleg. It's almost like not the real thing. Yeah. As good. It's not really. I've never really seen it.
Lazaro, Mesa MMA. What's going on, brother? Hope all's well. Coach, how you doing? And we will get right back to you guys over on Instagram. Let's talk to these TikTok guys. All right. Next one was I seen the change in the type brand of syringes cause irritation, just FYI. So he was throwing that comment out there about the burning sensation. Listen, not everything is created equal, right? Right, whether it's preventative anti-aging TRT, HRT companies, or even needles, syringes, or watches, or whatever it is. Usually you pay for what you get. And there are cheaper versions of these different things. So at that point, just make sure you guys are getting a good brand. Usually BD is probably the best brand out there.
We're most well known.
They're on it. So
there's a lot of websites that now because they sell everything now. People are even getting them on Amazon, these cheap, random, the quality isn't as there. I've seen them before. Even the tips, it's just not.
You go to stick yourself and it won't go in. It bounces back. You're like, man, what is going on here?
Or just the quality of it just looks like flimsy.
Yeah.
I don't know. It just.
Trust me, guys. I've used all the syringes out there. Sure Comforts, Nipos, pretty much everything across the board because I want to find out what was going to be the best because I'm sticking myself I don't know how many times a day. So at that point, I want to make sure they're going to go in smooth and easy and they're sharp and everything's good on them.
Yeah, cheaper is not necessarily better.
Definitely not. What lab should I get mid-cycle, hypothetically? Well, it just really depends what's going on. If it's like testosterone and stuff like that, listen, if you run our full panel, that's what I would kind of do just to see what's going on in all these different directions. Because free and total testosterone, you want to look at estradiol, progesterone, IGF-1 levels.
Yeah.
Cholesterol is going to change possibly with what you're doing. Thyroid might change depending on what you're doing. And you always want to look at a comprehensive metabolic panel because you want to look at your liver, your kidneys, your electrolytes, and a complete blood cell count. So you want to look at red blood cell count, hemoglobin, hematocrit, make sure you're good there because you don't want those going up because your blood's going to get thick, and then you're at a risk for a DVT, blood clot, or stroke.
Yeah.
And that ain't going to be fun either. And you have to recover and get back to where you're at. So I'd run our full panel, $150 with a discount. If you mentioned Titan Lifestyle, Amir Big Drew.
Yeah.
And you can get that done and see where you're at. Right?
That's another thing too. That's a great question, Alex. Is it seems like you're doing it the smart way.
Yeah.
A lot of times, guys will be mid-cycle and they're like, "Oh, I'll just figure it out at the end. I don't want to know anything right now. I'll wait another 5 weeks, 10 weeks, and I'll just once I'm done." It's good that you're mid-cycle to figure out whatever you're taking is going on with your body. A lot of people should start doing that more.
For sure.
A lot of people do it before. Or I'm off everything. I need to go get my blood work. They get their blood work. They start HRT and then they jump on everything and they don't get the blood work done until they come off of everything. Yeah. And once they come off of everything, that your blood work's really going to be a lot worse. You don't have an accurate read. So shout out to Alex for getting his blood work mid-cycle. I highly recommend a lot of people to do that. A lot of these compounds that people take, whether legal or illegal, affect your body differently. So it's always good to see what's going on mid-cycle or however you want to call it, in the middle of doing whatever you're doing.
Kip Fat Haynes, what's going on? Girl Ball as well. One more question on TikTok, and then we're going to go back to Instagram because we've got some over there. All right, so
Trent,
how to avoid hair loss on TRT?
How do you avoid hair loss?
All right, so
TRT? Male pattern baldness.
Yes, so male pattern baldness can affect males and it can affect females. Yeah. If you've had this in your family history, on your mom's side, on your dad's side, with your grandparents, this is something that you need to really watch out for. Now, the biggest thing to do would be test DHT levels, and that's a blood test we can run too as well. I think it's like $30. And at that point, dihydrotestosterone. Now, that is the real big one as far as for hair loss. So if that goes too high, then you're at a higher risk to start losing hair or start thinning. So there's a couple different things you can do. There are hair health capsules that have DHT blockers in there. I take those every day. Those are really awesome. Keeps the DHT in check, but it doesn't lower it too much. And you don't want DHT to be lowered too much. And that's the thing with Propecia, which is finasteride. That is the main FDA-approved product or medication for hair loss and for you to keep your hair. But what happens is that's like a male castration drug, and it literally kills your libido all the way. And you don't want that either, right? The whole point is to get the benefits of testosterone with minimal to no side effects. And that's where the hair health capsules will be really good. Also, our Titan hair foam, finasteride, Lantropost, and minoxidil, excuse me. So finasteride, like I said, is bad orally, but topically, it's not going to go like that. It's just going to go right onto the follicles. Lantropost is a thickener, so it's going to thicken the hair, and minoxidil will help keep the hair and help regrow hair too as well. So those are two main options that I would say for anybody that's looking to do that, and to always blood test DHT if you think you're having a problem.
Also, too, YG Lee, guys, he's always tuning. He asked earlier about how we could make his beard thicker.
Yep.
That might be a good thing, too. I want to see someone actually try that. I haven't seen that yet. I'm sure people are doing it.
You can put the hair foam on your face for sure.
Yeah, I want to see someone with the hair foam, like before pics, with a little bit of stubble so you can see how the hair grows, and then use it for a while, see if it increases that. Because beards, a lot of people wearing beards now, this and that. So, and a lot of guys are too far gone up top, myself included. So they got to keep the beard full. So it's like, this is the only hair you got, so you got to keep it thick. So I'm interested to see if people are doing that too.
Yeah, definitely want to see that for sure. All right, what do you recommend for a pre-workout? Back to Instagram. Embarras, I hope that's well. What would I recommend? I recommend ECA Stack Plus and Hercules Potion together.
Yeah.
So you get the stimulant effect from ECA Stack Plus, ephedrine, caffeine, aspirin, B12, chromium. And then you have the pump factor, the recovery factor, the liver support, the collagen support, the immune system support, and more with L-carnitine. Glutamine, arginine, ornithine, lysine, L-citrulline, proline, taurine, NAC, and L-carnitine. Even an anti-fatigue amino acid in there too as well. So you're going to get all the bang for the buck with this without any of the negative stimulant effects from pre-workout. And you're still going to have a stimulant, but your stomach's not going to be all messed up.
No itchy skin like we talked about earlier. No niacin in the ECA.
You're not going to overstimulate yourself too as well, and not be jittery and bounce it off walls like a ping pong ball or a pinball, I should say, because that's more like it. And that's going to be the best. That will be the best combination, I would say, for any pre-workout or anything you're going to do, strength activity-wise, whatever it is.
And if you wanted to add something to that, like I spoke about earlier, you could actually take IGF-1 with your Hercules and shoot it IM to the muscle you're training. So if you want to go a step above that and get even more crazy, IGF, Hercules, and ECA. But like John said, Hercules and ECA has been the go-to. It's not really a pre-workout, but I use it for that.
Yep.
And everyone else does too. So that's pretty much the way to go. Yep. And again, it's only 200 milligrams of caffeine, and we can take the caffeine out. So if people are like, I don't want too much caffeine, we could customize it for you. If you're allergic to aspirin, we could take the aspirin out. Yep. So just let us know anything that you want modified to it. But again, like John, it's nothing like it. There's nothing. I mean, there's
definitely
nothing like
definitely
it.
Nothing like it. Amanda, how you doing? Wolf, how you doing? Hybrid, what's going on? Jill V said, Jordan in the house. Pleasure Boutique, what's going on? All right, we got one more question here. 1 second. All right, so let's go back to
needles
Instagram.
are cheap. Buy them in bulk. Yep.
Yes, for sure.
And also, needles come with all of our HRT packages too. I've heard some crazy stories where people will get HRT and they'll just send them a bottle of testosterone. Like, where are you getting this from? Like John said, there's no other alternative.
No.
So when you get your stuff from us, you're gonna have everything in there you need. You're gonna have you're gonna have the right size needle and syringe to take your HRT. You're gonna have the right size syringes or needles for your any Hercules Post or anything like that. So everything comes. So you have no excuse. Like everything comes with it.
Absolutely. All right, so next one on TikTok. Male over age 50, fairly active and toned up. The diet, but having trouble losing the gut. Any tips? So if you're 50, you want to make sure your hormone levels are dialed in. So the blood test, make sure that's good. If you're on that, everything is dialed in, testosterone, estrogen, all that stuff. Then we start looking at some different things. If you're looking at losing the gut, belly fat, testosterone might be a good one for you. It's a GHRH peptide, raises growth hormone levels, and targets belly fat specifically. There's nothing else that does it. You could also look at maybe if you want to be more aggressive, like semaglutide, tirzepatide, if you're really trying to be effective in losing weight really quick. And then what's the activity look like? Fairly active, you say. Yeah. So what does that mean? Are you doing cardio? Are you doing weightlifting? Are you doing both? Or just brisk walking, right? Because that can mean fairly active too, I guess.
Another thing too is you say toned up the diet. A lot of times people, as soon as they go to a diet, they go out and buy everything sugar-free, sodium-free. Everything's just free of everything. Yep. The high amounts of sucralose and those sweeteners can affect your gut the older you get. Yep. So when you're 20, 25, you could take 5, 6, 7 packs of Splenda, whatever. Now it's not even like that. And other countries are actually banning sucralose, which is Splenda too. So that just tells you right there. Yeah. The older I get, the more I realize I'd just rather have some honey than Splenda.
Right.
Splenda's good on paper, but
are we talking about those sugar substitutes?
Yeah, it talks about the diet and the heartburn and all that. So you're having trouble with the diet, make sure it's really clean, not just, what they say is clean. Right. Look at the back of the label, not the front.
Right.
Probiotic helps a lot with that too. And just stay away from lactose. Whenever I have anything lactose, cheese, milk, and all that stuff, my gut is like destroyed. Right. It's like instantly destroyed. Within days, it's destroyed. So,
Soccer on TikTok says, if testosterone is meant to be lower as we age, wouldn't it be bad to take testosterone? And so, no. The answer is definitely no on this. Yes. And I give the flower example.
What?
I give a flower example for as we are as humans, because we grow, we bloom, we wither, and we die. Yeah. So at that point, that's what it is, right? So you grow, right, and then you're going to these ages. 18 to 21 should be your highest testosterone level, and then as you start aging, you start coming down. Now what's happening? Your body's starting to deteriorate, right, and then you die. Yeah. So for us, we want to try to trick the body to a certain extent, but we're not really tricking it. We're really doing it by replacing those levels that are deficient. That is what will help a lot of people stay younger, because as you age, growth hormone starts going down, right? And if that would stay up a little bit longer, you would probably have better improved skin instead of your skin getting all cracked out or not as appeasing aesthetically. Your sleep patterns mess up. All these different things. So if we can replace hormones and not replace too much, like not super physiological levels, but within normal reference ranges, that's normal for these age groups, right? So, when you get blood work as a 60-year-old or 70-year-old per se, the testosterone range is still the exact same as an 18-year-old or 19-year-old, the reference range. It's where you fall on that. And that's my point to this. It's not bad. And we have plenty of proof that taking testosterone replacement therapy when needed is beneficial in so many different other ways for health. One is cardiovascular. That was the big myth. If you take tests, you're going to die of a heart attack. You're going to get a blood clot. This is true if you're not monitoring your testosterone levels, and red blood cell count, hemoglobin, and hematocrit go up. Yeah. But when you monitor that correctly and everything's good, everything's going to be working at optimal levels and how it should. Yeah. And that's the best way I can describe it.
Another thing, too, is you said if testosterone is meant to be lower as we age, wouldn't it be bad to take testosterone? Just throw another word in there and maybe it'll make more sense for you. So in other words, if you say, as we get age, we're supposed to have more belly fat, so shouldn't we just keep that belly fat? You know, if you use something else, it's like, okay, that makes sense now. You want to, even though you will go lower, that's the whole reason why you would take it in the first place. Right. To avoid that problem. So a lot of times people say, I don't want to fight nature. You're not really fighting nature. You're just keeping yourself in a better position than you were. Probably from all the processed garbage food you've been eating your whole life. Yep. You know, if you go in a third world country out in the jungle somewhere, those guys could get their test levels. It could be 800, 900. They've never done anything. It's true. Because they've been picking their food and hunting and picking their food rather than microwaving it for 40 years of their life. So.
And they're not having environmental issues, toxins you're breathing in and all this other stuff that are affecting hormone levels, right? So, you know, a lot of people are deficient or how can you explain? All right, so Soccer, when you said this, right, think about this. As you age, that'd be one thing. If a 50-year-old guy had a lower testosterone level, I can understand that. But when 20 and 30-year-olds are having testosterone levels like 60-year-old men, there's a problem there. And that needs to be fixed, especially if a guy is late 20s, early 30s. He has a lot of life ahead of him, or she does. And at that point, you got to fix the problem because they're going to be dealing with these negative symptoms. They're tired, they're fatigued, they're putting more belly fat on or body fat in general. Their brain's not thinking, they're foggy thinking. So there's a lot of things that go along with this. Libido sucks. Yeah. And think about this. They're at the earlier stages of their life, at that point where you might be looking to develop a family and stuff like that, and you want to have great sexual relations or whatever. So this is just something to think about, and all together.
Yeah, especially with women too. With women too, they if a lot of women took birth control when they're younger, and it kind of affects their hormones and testosterone and stuff like that too. That's another reason why you may need HRT even as a woman, because women have testosterone too. They just don't have as much. Right. If your testosterone is too high or too low because you've been, popping birth control since you were 14 years old every single year. Yeah. And now 20 years later, 34 years old, hormones are all out of whack. That's even more reason to come get your blood work done. Sure. So we always talk about testosterone for men. Women, if you were on birth control, whatever kind you were taking for all those years, it's very good to get your blood work done. Absolutely. Just to see where everything's at, even if you don't feel a certain way, because that could, it's going to affect you 20, 30 years down the road as opposed to when you were 16 and you were in high school and you didn't want to get pregnant and your mom got it for you and told you to be safe and this and that. So ever since then, it's been going on and on. So it's very important to get your blood work done as a woman.
Even after, females had babies, their hormones are all jacked up. They go through postpartum depression. That's because their hormones are all jacked up. And at that point, after those females are done, breastfeeding, if that's what they're doing, then they can get help too as well and be able to get back to normal and get that baby fat off faster, right? And feeling better. 50-year-old fat man, no workout, low test score was 324. Is TRT okay for me? Yes, school bus. It should be okay with you. Just our medical providers would definitely like to look at your health history just to make sure, hey, listen, you didn't have an open heart surgery or something like that. But if you're generally healthy and there's nothing going on health-wise and you just have low testosterone and you don't feel like you should, don't matter if you work out or not. Testosterone and getting it into a good level is more about general health and better health. You don't have to work out, but listen, if you do work out, that's going to have a ton of different benefits for you. But if you don't, it's okay. But it would be the best to get that level up. And yes, you're perfectly fine at 50 years old. We can help you out. Titan Medical Center services nationwide, so we can help you out with anything we do. So just give us a call or text, 727-389-3220.
Early Bird says nervous about crashing his estrogen. That's another reason why the blood work's going to show that. It's going to show you how high it is, if it's too low, too high. Yep. But again, if you go through a medical provider, if you come to Titan Medical Center, our medical providers they're known to they're trained to look at that. Yes. So it's not like it's going to get too low. We're not going to tell you about it. You know, if it gets too low, chances are you're going to get a text message, an email, a phone call.
Yes, you're going to get called.
It's like, hey, you know, we notice you're this and that, and they're going to tell you how to fix it. So as long as you're going through a medical provider, not just doing your own HRT, they should be monitoring all that for you. If they're not, even more reason to come to us because we will.
100%. A lot of places will just give you your stuff and no support.
Yeah.
Yep. And you can talk to them a year later, maybe get a blood test, and something might happen. Shauna Purcell, what's going on? Heidi, what's going on? Josh, how you doing? Rod Galloway, Wellness Concepts, how you doing? Down to Flex. Wellness Concepts said, what if you have a small amount of gyno and you go on TRT? Do you need the gyno removed first before going on TRT? So no, you don't. But this is going to be really important to control your estrogen at that level because you don't want any flare-ups. If you do have a little bit of gyno and you're not keeping your estradiol in check or estrogen in check, you're going to get flare-ups in the nipples, and this could be even worse, right? So at that point, you can go on it, but whoever's monitoring you needs to know that, and at that point, they've got you covered with, you know, an estrogen blocker like we always do, and that might even be a case to take tamoxifen, right? Because when we start talking about aromatase inhibitors, we start going through the degrees. Now, tamoxifen was one of the first aromatase inhibitors on the market.
Old school.
Yeah, aromatase inhibitors were made for breast cancer patients, male and female, because males do get it too. And at that point, it hits just the breast receptors, where anastrozole starts taking all the estrogen out as far as that goes. So, you know, to go back and forth, if you have any flare-ups or you have any problems, that might shrink it down a little bit for you and keep it in check when you're on TRT or HRT. And you can always get the surgery no matter when. If you're on HRT, not on HRT, that can be done very simple and very easy. And my opinion is this: even if you get the surgery, make sure you keep your estrogen in check. There's a lot of guys that say, oh, I just got everything cut out. Oh, that's great, but you still want to keep your estrogen in check because of the other negative symptoms that you could possibly get.
Yeah, exactly. That's what I was talking about earlier. Some guys don't get that breast tissue growth, but they get everything else. Yeah. And again, too, if you're going to get the surgery, don't just go the cheapest route. Yeah. Make sure they're removing the gland as well. If they don't remove the gland, they just remove the tissue, it's going to grow back.
Oh,
so
for sure.
Don't just say the cheapest one. Do your research. Make sure it's from someone that's reputable. They take the gland out. And again, like John said, once you get it out of there, still keep it good. A lot of guys are like, oh, I don't need an anastrozole anymore because I got the gyno taken out. Well, that just fixes the breast tissue. It doesn't fix the gyno all over your body.
Yeah, no, it's true. It's so
the estrogen
true.
all over your body.
Next one was, should I use finasteride with DECA and RAD 140? So, nandrolone actually produces more progesterone, which can actually help you grow hair, if you can believe that. Yeah. But RAD 140, I wouldn't really mess with. I mean, that's what, you know, as far as SARMs. And,
that's what we got MK-677 for.
Yeah, I
pretty much the same type of what it does in terms of muscle building and growth, less side effects, easier to take.
And then the other problem is this: you start taking nandrolone and decanandrolone, and I don't know how much you're going to take, but then you have to worry about the issue with erections. And finasteride is just going to add more problems to the libido effect. So you might be setting yourself up for failure in the bedroom. But if you don't care, and let's say you ain't got a partner, and you just want to hit the gym and get big and do all these different things, that's a whole different story.
Yeah, and doubling up on your anastrozole, your tamoxifen, or Arimidex, Novadex, however you want to call it, isn't going to help with progesterone. It's going a different avenue. It's going to actually increase your It's going to make you lactate. So guys that take high nandrolone, which is DECA, high dose for a long period of time, their nipple will actually leak and lactate. So when that happens what do they say is, oh, I need to get an anastrozole or letrozole because they get so paranoid they want to kill it, but it doesn't actually do it. You need something different. Yeah. Whether it's Dosternex, Cabergoline, Pramipexole, certain things that will lower your progesterone. But again, it's just, I don't know, when you take DECA, it stays in your system for up to a year. Yeah. There's been high school athletes, football players that have gotten injuries. Their mom takes them to the doctor. They give them a shot for the pain. Next thing you know, a year later, they get an NCAA. They're failing the test off nandrolone. So that's another thing, too, is if you're getting tested, be very careful because nandrolone, also known as DECA, will stay in your system for literally up to 10, 11 months off of one single injection, depending on how it is. So
it's true.
Got to be careful with that.
It's true. And what he was talking about was prolactin levels. Yeah. So if prolactin levels go high, you will start leaking out your nipples, and I've seen it.
Yeah, you literally lactate.
You will lactate, 100%. So, and listen, there are people that have high prolactin levels, and that could be from a number of different things, like prolactemia, which is a tumor. on the pituitary that's creating that and stuff like that. So if you have high prolactin levels and you're not taking anything, there should be something to look at with that too as well. Okay, how does test reduce body fat? So test doesn't really affect body fat. It improves metabolism, which helps burn body fat. It doesn't, you don't inject tests and it just starts reducing body fat.
Yeah.
Like I said, there's no drug out there that reduces body fat directly in a specific shot. It reduces it overall if you're doing a weight loss program, except for testosterone, which is the visceral belly fat, and that's it. So
so anybody here belly, testosterone's where it's at right now.
for sure,
It's one of the newest things we have. And
FDA approved. That's definitely a good one.
So now's the best time. People are trying to get ready for summer now. It's only a couple months away or a month away, however you want to call it. But grab some testosterone, some ECA. You'll be ready for the summer.
It's extremely weak to pharmaceuticals. I agree with wellness concepts on this. How can I buy a Tight Medical t-shirt? Guys, please support us. You can go to tightmedicalcenter.com. You can pick out any of the t-shirts we have. We have a number of different colors, and I have more colors that aren't even listed on the website. So if you're looking for something different, just call or text us. But you can buy a shirt right off of there. We've got V-necks, we've got crew necks. We've got all kinds of different stuff. And I started taking pictures of some of the new stuff too as well, so we can get that loaded on the back end of the website so you guys can purchase it. And I've got new stuff coming too as well. So we've got a lot of Titan gear. But if you guys would love to support us by grabbing some Titan medical gear like that and wearing it, maybe tagging us in those pictures, we would really appreciate that. We love that.
Yeah, a lot of guys always see us with the V-necks. We pass out the V-necks at the shows. Just now, like John said, we have a whole merchandise room back there full of dry fit quality hoodies, sleeveless stuff, Razorback tanks for women, sports bras for women, leggings for women, Y-back tanks for guys, long sleeve hoodies, Scullies, everything. Titan mugs. We got Titan mugs. Keep your drink hot or cold for 48 hours. We have a whole bunch of stuff, not just the T-shirts that we hand out at the show. So we got a whole everything back there.
So even now, like if you guys are going to any Titan Medical Center events, we've been bringing some of the Titan tank tops to give away too as well.
Yeah, those tanks are nice.
Stringers, and those are really, really nice. We have sleeveless hoodies that are really, really nice. I think we'll see how it is out in Olympia and stuff like that. We'll probably bring a lot of those to give away too as well. And some
hats too.
Shows Tampa Pro
Snapback hats, fitted hats.
Yep.
3930, the real good fitted hats, the ones with a little bit of a stretch to it. Those are nice too. Stitched in, real quality.
Yes. So, high quality.
Got everything back there.
We do, right? Liz Cordero, what's going on? DJ and Small Man, what's going on? YG Lee said, and this is a good question. This is kind of off topic of what we really talk about, but this is a really good one. Does a GED have the same benefits as a high school diploma?
Yes. In this day and age, it probably does.
It does.
It probably does.
1,000,000%.
I mean, who the hell asked for a high school diploma? I've never in my life, at every job I've had, where they say, "Let me see it."
They don't ask anymore.
They don't ask at all.
They don't ask anymore.
You could probably not even go to high school and get a job just off of your experience and if you have a degree and all that stuff. But it's like,
it's true.
Do they ever check? Do they ever call and say, "Hey, did this person graduate in this year?" I don't think they do that.
I'll be honest with you. I mean, I've never asked any of our employees if they had a high school diploma because I'm just past that. Like, what are your certifications? And usually if you have certifications, you went through high school, and you went to college, you went through high school. Or you have a GED, which is totally fine too as well.
Not only that, if you went to a garbage, low rating, like say if it's like in a bad inner city neighborhood where the grading system is terrible and all you did was pass.
Right.
I mean, why is that?
Yeah, who cares?
Yeah, you're gonna be the same as a valedictorian at like one of these private schools over here. Right. In terms of on the paperwork, there's gonna be like, you graduated.
Yeah.
I mean,
you don't have like your GPA unless you put that on there.
I mean, it looks good if you put valedictorian and all that stuff on your resume, but I mean, depending on what you're doing, I don't know. That's a good question though. Yeah, I think obviously a college diploma, that's completely different.
Yes.
Especially if it's prerequisite on the job you have. But
GED and high school diploma is the exact same thing.
Yeah.
It's the exact same thing. And I know plenty of people out there that are multimillionaires that just got a GED.
Yeah.
They quit school. I'm not saying that's a good thing at all. They had to find themselves and they turned things around and did it. But I definitely had it. I've definitely had an employee that was with us for quite a long time where she was. We got 10 minutes left. She was homeschooled. Her parents told her it was going to be credit, and she went to go apply to a college, and they said all these are unacceptable.
Oh wow!
So she had to go she had to go take a GED test so she could pass so she could start going to college.
Now, YG, are you talking about, does it have the same benefits in terms of going to college or just in the real world? Because I'm assuming that some colleges would rather prefer a high school diploma as a GED. I mean, if you're going to Harvard, Yale, Cornell, Princeton, they're probably going to be like, why do you
They're going to be looking a lot more than that.
Yeah, but I mean, in terms of employment, in terms of a career, in terms of, I've never seen it making a difference to me.
Jay Martin said, thanks, guys, for getting the info. I'm in. Can't wait to get started again. We
Nice.
can't wait to help you.
Nice.
And please let me know. You can come on my Tuesday show, the Friday show with me and Drew, and just give us some feedback. Hey, let us know what's going on. If you have any questions, it's good, positive feedback. Let us know so we can help and make sure you're on the right track.
And I always like to hear the difference, what Titan brings to the table as far as the other places. So when we have all these, other alternative medical places, they have a bad experience, they come to us. I like to see the difference. So after they've been with us for a couple months, tell me why we were better than them, pretty much. I like to hear stuff like that too. So.
And Lewis said, he's right. I do primary care, and I agree with this guy 100. Yes. Thank you. Listen, I know all the ins and outs and behind the curtain what's going on in all these practices and how they ran and how it works with insurance, without insurance. So at that point, I always give you the most transparent information about what's going on because I have nothing to hide, and I want to make sure you guys don't get fooled because there's a lot of different, and you don't know. It'd be like anybody else's business. I don't know how, I don't know, a nail tech does nails. I couldn't do nails, right? I can't do lashes. I can't do this. I can't do that. But I know this business. So at that point, I can help you out. What else we got here? All right, wellness concepts. If you have a small amount of gyno prior to PD use, do you need gyno removed before going? I think we answered that one already. Yeah. John, you're the owner of Titan Medical, ain't you? Yes, I am. I'm definitely the owner, founder of Titan Medical Center. I can tell you guys the story of how I came about Titan Medical Center and how I came up with the name and all the colors and everything we do here. First emblem. So much respect for Team Titan for answering questions and teaching people all of ages.
Nice.
Thank you. We appreciate that. And that's what we're here to do. We want to give you guys the best knowledge out there, the most information, so you guys can take that information and be able to utilize it for yourself, for your health, for your family, and everything around that. So we appreciate that very much. Thank you. What else we got here? Trams. Tampa Metro's on here. Never some. So, been on test for 6 months. Been amazing. But now I have back knee, which I never had an issue with. Any suggestions other than soap and water? Absolutely. There's one thing that's going on.
Estrogen.
For sure. You know it, and I know it. So your hormones are off. Estrogen is definitely off in your body. Whether it's too low or too high, that's what's affecting the back knee. Or if you get chest acne too as well. Yeah. That is the main driver of it. So we need to get that balanced. Now, after that, what can help clear it up fastest, right? Now, we have an acne protocol that we use for all our patients. It's got 2 different components. It's got clindamycin, so antibiotic white pads, and it's got a benzobentonate wash. So it's a benzoate wash that you would use. You'd use this in the shower, in the bath, whatever it is. You'd wash your body to the affected areas, and if it's the back, have your girlfriend or wife or whoever's over there do it for you, and then you'll wash that off. And then after that, you'll use the pads, and that will get the antibiotic in there too as well, and it will dry up and clear those areas up a lot faster, a lot quicker. So, you have a clean back.
Yeah.
Especially with summer coming. I mean, that's
why
we put in all this hard work, right?
Yeah. Another thing too, John said, even if you don't have anybody to wash your back, just get the loofah with the stick on it. They have so many scrubbers. I have one. I have a blue one, a black one. Yeah. It's a scrubber thing, so you could actually just exfoliate it while you're working that in there. Yeah. But a lot of people don't even wash their back. They just rinse it off. A lot of guys, they just rinse it off because they don't have nowhere to get to it. And it's like
bacteria.
All the residue from their shampoo is just falling down their back, and they never actually get in there and scrub it off.
So if you don't know how the body is, and even if you don't work out, right? Look, there's diagrams, there's videos online that you can say, all right, what happens to my body in 7 days if I don't take a shower, and what does the bacteria growth look like? And they've actually showed this. And bacteria starts growing on your body.
Yeah, with the black light, you see all the...
Yeah, so you want to wash to get the bacteria off because too much bacteria, a little bacteria in the body is fine, but too much and over... I mean, this can get in. If you poke yourself, that goes into the skin, goes in the bloodstream. I mean, it gets set up some different things like cellulitis and stuff like that. We will take blood work from another doctor as long as it's within 60 days, and it's all the tests that we require for whatever program you're trying to go on.
Full panel.
Yep. Great information here, guys. I will definitely be serious considering your service. Wellness Concept, thank you, man. We appreciate you just joining us. Join us next Friday, too, as well, or Tuesday with me.
Someone asked NJVN asked, does test affect your appetite? It will increase your appetite a little bit, but it's not going to be overwhelming like MK-677.
Yeah.
But if you have a problem eating, like if normally you used to eat fine, now all of a sudden you'd have a hard trouble eating, that could be a result of low T as well. So yeah, it is going to increase a little bit, but it's not going to be, MK-677 level where you're just eating all day long.
Yeah, I won't be stimulating that G-Relin hunger hormone for you. Khalees, how you doing? Farrell, how you doing? John Lopez, Jeremiah, Lisa Lane, what's going on? D-Mark, all right.
Wellness Concept says, great information. He will be considering our services.
Yes, that's awesome.
Great.
That's awesome. Broken Line Fishing Apparel, do you take insurance? So, unfortunately, we do not take insurance. The reason why is because most of our services and medication therapies that we offer are not covered by insurance. And some people are like, well, sometimes testosterone is covered. Yeah, sometimes it is. But insurance companies want 2 clinically AM deficient readings. So that would mean that even if it was 264 to 916 and you came back at 264, you're still within normal range. And you're in the bottom end, but you're still in the normal range. So it won't really cover it. And blood tests, it's a pain in the butt. So at that point, we just don't do it. It's a lot simpler. It doesn't restrict our providers and what they want to run blood test-wise or give you therapy-wise too as well. All right. And then what else we got here? We got any more questions?
I get that question a lot.
Cool. Thanks, guys. I'll check in with the team. Nasty. I wash my back. All right. Definitely wash your back. How many we got? 4 minutes. 4 minutes. If you guys got any questions, get them out. Otherwise, I think that's about it. We didn't get to cover our topics today, but we had great questions.
Yeah, we got great questions.
We'd
always
rather
good
have that.
questions. I'd rather answer people's questions and talk about sports or something like that.
Yeah.
So it's more important. But
Yeah.
we'll get to the topics next week. I don't know if you guys can see them up on the screen, but if we can remember, we'll get to those next week. We're jumping into maybe some therapy of the week before we go off.
Absolutely. I was just thinking that.
Yeah.
All right. So listen, therapy of the week is MK-677.